Hello, my name is Chris Lamb. I'm one of the cardiologists here at Veterinary Cardiologist Australia. Today in this video, I would like to demonstrate to you how to perform monitoring sleeping respiratory rate. Sleeping respiratory rate monitoring is a very easy to do but important tool for animals that have been diagnosed with heart disease that may pose them at risk of developing fluid in their lungs or in their chest cavity, or medically termed congestive heart failure. To perform sleeping respiratory rate monitoring, all we have to do is wait until the dog or the cat is at a deep sleep state, slightly further away from us. And what we want to observe is over their chest area or in their belly, a gentle up, down, or an out and in. Remember, when we breathe, we have to inhale and exhale. So every up and down or out and in represents one breath, and we don't want to do that as a double count. Once you've observed a regular pattern and it is nice and slow, you can then initiate the count. All we want to do is count how many breaths they take in a minute's time. However, sometimes certain animals won't really allow us to count or stare at them for a full minute. So we can do what's an abbreviated count over 15 seconds or over 30 seconds, and then multiplying by 4 or 2 to get a rate over a minute. How do we interpret it? Anything less than 30 breaths a minute is representative of normal. It is highly unlikely for a patient to have a breathing rate less than 30 breaths a minute to indicate a large amount of fluid accumulating in their respiratory system. However, if we have a persistent increase in breathing above 30 breaths a minute at rest, then it may indicate development of fluid. We must, however, remember that there are many other reasons a patient can breathe a bit fast. Something as simple as having a dream, or other factors such as climate, heat, humidity, or thunderstorms, or having fireworks, or anxiety, discomfort, pain can all increase a breathing rate. So having an increased breathing rate does not automatically mean there is fluid in the lungs. However, if it's persistent and it's over a period more than what we normally expect, maybe it's a few hours, maybe it's over a day or so, then we need to do further diagnostics to confirm. Once we've detected your dog or cat has a persistent elevated breathing rate, what we want to do is get them prompt assessment by a veterinarian. If you're close by VCA, of course, coming straight here for us to perform either a chest X-ray, a oxygen level, or a thoracic ultrasound may be what's needed. But if you're quite far away from us, then your local general practice or emergency clinic are also good sources. To further assist in monitoring our breathing rate, these days there are also many phone apps on our smartphone device that can help us with that. Simply checking with the clinician at VCA or doing a quick search may reveal a few different phone apps that allow you to monitor daily. Many of these apps will have a pattern of shape of a heart or a pattern of a lung. Every single time the chest goes up, you just have to tap that pattern and it'll work out the sleeping respiratory rate. If you have any further questions, please feel free to reach out to the clinician here at Veterinary Cardiologist Australia or reach out to us via email or phone call. We'll see you next time. Thank you.